Hello, we are Medivery University Hospital. In this video, we will explain to you what gastric cancer is, the symptoms of gastric cancer, and the causes of gastric cancer. Our channel provides information about diseases and medical health according to a Japanese physician. If you are interested, please subscribe to our channel. Statistics on gastric cancer. According to statistical data on cancer mortality conducted by the National Cancer Center in Japan in 2019, the total number of people who died of cancer, both men and women combined, was 376,425. Of these, 42,931 people died of gastric cancer. Looking at the number of patients diagnosed with cancer in 2017, the most common cancer for both men and women was colorectal cancer, followed by gastric cancer in second place and lung cancer in third place. Furthermore, when looking at the 5-year relative survival rate by site, it is 65.3% for men and 63.0% for women, indicating that the 5-year survival rate for gastric cancer is relatively high. If the cancer is diagnosed while it is still confined to a small area, the 5-year survival rate is 95.9%. What is gastric cancer? Gastric cancer is a type of cancer where the cells in the innermost lining of the stomach, the mucosa, become cancerous for some reasons and proliferate uncontrollably. It is said that it can take several years for gastric cancer to grow to a size where it can be detected through screenings, such as gastric cancer screenings. As the cancer grows, the cancerous cells invade deeper into the wall of the stomach, spreading to the outer serosa, and even further, affecting nearby organs such as the colon and pancreas. This spread of cancer is known as invasion. Cancer cells can also travel through the lymphatic fluid or bloodstream to other parts of the body and proliferate there. This is known as metastasis. The most common type of metastasis in gastric cancer is lymph node metastasis, where the cancer proliferates in the lymph nodes, which act as checkpoints in the lymphatic system. This can occur even in early-stage cancer. In some advanced cancers, metastasis to the peritoneum and liver is also observed. Serous gastric cancer. A special type of gastric cancer is serous gastric cancer, which spreads within the wall of the stomach without appearing on the surface of the mucosa. It is said that serous gastric cancer accounts for about 10% of all gastric cancers. At the time of diagnosis, metastasis is found in 60% of patients with serous gastric cancer. The symptoms are not specific to serous gastric cancer and are almost the same as those of regular gastric cancer. Some patients may initially complain of back pain, which is referred to as referred pain. This is not a direct pain in the stomach, but a phenomenon where pain appears in a different location due to the influence of shared nerves. Furthermore, since serous gastric cancer rarely appears on the surface of the mucosa and infiltrates, the wall of the stomach, it is difficult to detect with an endoscope, and it is often already advanced when found. Therefore, there are cases where symptoms of gastric cancer are present, but no abnormalities are found in examinations, leading to a delayed diagnosis until the cancer has progressed. This example of serous gastric cancer is the most typical, but gastric cancer often does not show any symptoms in the early stages, and there may be no symptoms regardless of the extent of progression. Conversely, symptoms such as stomach pain, heartburn, and black stools may appear from an early stage. These symptoms can also be seen in conditions such as gastritis and gastric ulcers. Therefore, it is common for people to assume that it is not gastric cancer, but another stomach disease and ignore it. Regular screenings are important, but it is also crucial to seek medical attention promptly when symptoms persist, as this can lead to early detection of gastric cancer. Symptoms of gastric cancer. It is said that symptoms rarely appear in the early stages of gastric cancer, and even as the cancer progresses, it may remain asymptomatic in some cases. The initial symptoms are often overlooked as simple stomach discomfort because they resemble those of concomitant gastric ulcers and gastritis, making it difficult to recognize as gastric cancer. In the stage classification of gastric cancer, stage IA corresponds to the early stages where the cancer is confined to the mucosa and submucosal layer of the stomach. Since the surface of the stomach is mucosal, it is considered that no significant damage has been done to the stomach itself yet, resulting in a lack of symptoms. However, symptoms may appear depending on the location of the cancer, such as in the cardia of the stomach, leading to discomfort and a feeling of heaviness in the stomach due to the retention of food. The following symptoms are observed in the early stages of gastric cancer: indigestion and discomfort in the stomach, a feeling of bloating and discomfort after eating, mild nausea, loss of appetite, heartburn. As gastric cancer progresses, the following symptoms may appear. 1. Loss of appetite, nausea, and vomiting. As the cancer narrows the digestive tract, food passage becomes poor, causing a heavy feeling in the stomach. This may lead to a loss of appetite and vomiting. 2. Malnutrition and general fatigue. Due to loss of appetite, nausea, and vomiting, the body may not absorb nutrients properly, leading to weight loss and a feeling of overall weakness. 3. Hematemesis and melena. When cancer causes the cells in the stomach to break down and bleed, the blood accumulates in the stomach and is expelled from the body. This can result in vomiting blood or passing blood through the rectum. When blood is passed through the rectum, it is often oxidized by stomach acid and appears as black stools. 4. Abdominal pain and discomfort. Pain above the navel or in the epigastric region, or a dull pain and a feeling of discomfort in the abdomen before or after meals. Although not specific to gastric cancer, this is a common symptom reported by patients with the disease. 5. Heartburn. This symptom may occur when cancer develops at the junction of the esophagus and stomach. The flow of food becomes poor, leading to a feeling of food stuck after eating and a sensation of food coming back up. This is a common symptom of gastroesophageal reflux disease. Additionally, as gastric cancer progresses, jaundice, yellowing of the skin and whites of the eyes, ascites, accumulation of fluid in the abdominal cavity, and dysphagia, difficulty swallowing, may occur. These symptoms do not apply to all individuals with gastric cancer. Causes of gastric cancer. There have been many studies on the causes of gastric cancer, and some risk factors have been identified. Among these, infection with Helicobacter pylori is recognized as a particularly strong risk factor. Helicobacter pylori is a bacterium also known as H. pylori, and it has been classified by the World Health Organization, WHO, as a definite carcinogen. When H. pylori infects the gastric mucosa, it causes gastritis on the surface of the stomach. If the infection persists, chronic gastritis occurs, leading to gradual atrophy of the gastric mucosa. As a result, it is believed that the cancerous transformation of the cells forming the stomach wall progresses, leading to the development of gastric cancer. A famous study comparing the incidence of gastric cancer between individuals negative and positive for H. pylori infection showed the following results. 1. Individuals who were negative for H. pylori. None of them developed gastric cancer even after 10 years from the start of the study. 2. Individuals who were positive for H. pylori. Approximately 2.9% of them developed gastric cancer about 10 years after the start of the study and received treatment. This means that about 1 in 34 individuals infected with H. pylori developed gastric cancer, indicating that the risk of developing gastric cancer is not low. Other risk factors for gastric cancer include excessive intake of salty or smoked foods, insufficient intake of vegetables and fruits, alcohol consumption, smoking, and frequent consumption of poorly preserved foods. Additionally, being male, elderly, having chronic gastritis or gastric polyps, or having a family history of gastric cancer also increases the risk of developing the disease. Physicians' comments. Gastric cancer is one of the most common cancers among Japanese people. However, it is also one of the cancers that can be prevented. Specifically, eradicating H. pylori can lead to prevention. Currently, there are few cancers that can be prevented in advance in medicine, but for gastric cancer, eradicating H. pylori can certainly reduce the probability of developing the disease. Especially those who used to drink well water are considered to have a high possibility of being infected with H. pylori. If you have a history of drinking well water in your childhood or are concerned, it is advisable to visit a hospital and undergo testing for H. pylori and, if necessary, receive eradication treatment. How was the video? We want to know what you would like to see made into a video. If you have any health questions or unexplained symptoms that you're concerned about, please let us know in the comments section. If you found this video informative and interesting, please like and subscribe to encourage us in our future activities. Thank you for watching.